Thank you for joining the Girl View podcast today. We're going to be discussing the size matter. Listen, don't be getting all in your feelings, because guess what? What's for me might be something different for the next woman. So it's all relative, right? I got some heavy hitters today. I got Dr. DeLorean Griffin, who's a plastic and reconstructive surgeon. I also have Miss Shuntai, who's a licensed clinical therapist. And we're going to be talking about options surrounding the size matter. Please, as we go along, feel free to enter your thoughts and comments. And tuck your feelings up. Man, I mean, when we were coming up with this topic, I have ran into so many people that have reminded me how hard it is for them to talk about sex. And this isn't even a sex show. Needless to say, you're going to enjoy this show. And if you aren't laughing at the end of this show, then something is wrong with you. We're going to just jump right in. Ms. Hill, I'm going to start with you. And again, I'm just going to throw out there, why do you think sex is a difficult topic for, for people these days? And while you're thinking about walking us through that, also tell us what it takes to become a licensed therapist. And also, I know that you deal with patients in relation to sex issues and different things like that. If you don't mind, tell us how do you get there? How do you get to a point where you are you can be in front of people and deal with them on their mental and sex issues?
Okay, as a licensed professional counselor, I'm licensed through the state of Michigan. I have a master's degree from Liberty University in professional counseling. So that means that I am able to diagnose and treat mental health disorders. And on top of that, as far as my specialty that I work with, I had additional a year or so of training in order to specialize as a sex therapist.
Got it. And so when you're dealing, before that, I thought this was hilarious, and I want you to shed some light on this. I found this on the internet, and I know the internet is not always the truth or whatever, but true or false? So for patients that need practice in the bedroom, you're a sex therapist, right?
Uh-huh.
And they have no spouse or partner to turn to. Some sex therapists turn to surrogate partners. Surrogate partners are people who help patients with intimacy issues using a hands-on approach. And it said that surrogate partners with the patient, this can include having sex with the patient. Is that true?
That is false. If you are a certified
I was hoping.
if you are a certified therapist that specializes in sex therapy, that is against our code of ethics to have sex or any type of relation or even to watch our patients have sex.
So anybody who's having sex with their patient, and this goes for the patient, if you're having sex with your therapist and it's being told to you that it is a part of the therapy, they should be calling the police, right?
Because you know what? More than likely, you're not in front of a professional, a true professional. Yes. Anybody can call themselves a life coach or someone that specializes in sex therapy.
Yes.
But you have to check the credentials of the people that you're sitting in front of.
Yes, yes. Now, do you think, again, the topic is do size matter, and people can make assumptions in terms of what size or what we're actually talking about, and again, even taking it back to my thinking that people are, have a difficult time discussing sex. And I'm going to throw out some rationales that I think is behind it. One being we kind of grew up, and even we teach our kids this, and it's not necessarily wrong, but we grew up only being taught and educated about abstinence. Nothing wrong with that. But in my opinion, as an adult, I think back, I don't think we were taught anything in terms of, hold on, I'm about to change something. I don't think we were really taught in terms of how to deal with things when we want to have sex, how to even negotiate our needs, as it relates to sex. So then when we're confronted with those things, it's like, oh, that seems kind of nasty. I don't want to talk about it. Even if we're talking about, something, just as trivial as, does size matter,
Right.
So in a
Trivial.
relationship, why you say that? But yeah, talking about size, again, so when you seen it, what did you think? Were you offended?
Me?
Yeah.
Me? No.
Yeah. What's there to be offended
I'm not
about?
offended I'm not offended because I don't have a size issue, but there are men that do.
Right.
So they may have been triggered by that
Okay.
particular,
That, yeah, and you know what? And now that you say that, but size is relative. You know what I'm saying? Like, for example, if a woman talks about size, then that's relative to her. Because if let's say if I'm saying, oh man, he was big, he was big. One, that's based on my depth and everything. For the next woman, it might be he's too little or too big.
right,
He might
right.
not be somebody that you brag
It's a
about.
compatibility thing.
It's a
Right.
Right.
compatibility thing, exactly. So I just found it very interesting that people were getting offended by it, and like you said, Dr. Griffin, it could have been that maybe they just, there is a trigger for them because maybe they feel inadequate or insecure about it. But that's why I'm glad that you both are here because we can discuss some options. So Miss Hill, tell me, do you think sex is important in a relationship?
I think not sex per se, but intimacy is very important in a relationship. Because sometimes when people think about sex, they think about insertion. But sex is more than just about insertion. You can fulfill someone without even inserting their penis into them or any objects into them, and they can still be fulfilled.
I
So it
agree.
just depends on the relationship and what the compromise is or what that couple is used to.
That's right.
Yeah.
So when tell us what are some general concerns that that you are confronted with or that you deal with your patients.
Well, first, I do want to dispel the myth. Size does not matter. Size does not matter, and I'll tell you why. The average size of a male's penis is about 6 inches.
Okay.
It only matters when, okay, so the average size goes between 4 to 6 inches, right? And
Yeah.
with a woman, when she's fully aroused, it can get a little bit over 4 inches.
Okay.
So that wouldn't be a problem. Now, the problem is if they're on the low end or the high end. So if a man is well endowed, it could be a problem fitting his 9 inches into a space of 4.
Right.
So they're hitting more than just the cervix. Let's just say that. And it can make
Right.
sex painful.
Okay. Right.
And if a
Right.
man
And
is,
uncomfortable and
yeah,
exactly.
yeah,
Exactly.
so
And then nobody's enjoying that.
then nobody's enjoying that. And most men do, even if they're size 4 inches, that they can still fulfill a woman. Now, it depends on too what she's used to. If
Okay.
she started off the game with a 9
Yeah.
and end up with a 6 or a
Right.
5, that's going to be a problem because she's used to that space being full.
Okay. But like we were talking about the insertion or the actual intercourse or penetration, there's much more to it than that.
Yes.
So again, and you can tell me if you think differently. Women, we're emotional, and so when a man taps into our emotional beings, then to me that's way more than probably what they can do penetration wise.
Right. Then we
Okay.
tend to get an area where they compensate
Yeah.
for the inefficiency that may be there
Yeah.
because love is very powerful. That's just how powerful
Exactly.
love is.
Okay, that's right. That's right. And so, again, so tell us some examples of what you might be dealing with a patient. What do they come to you for in terms of sex related issues? Are they talking about size? I know you said size doesn't matter, but are they coming to you about size, or what are they coming to you for?
Not specifically, you don't hear the size thing right away.
Okay.
It's more of not being fulfilled. Maybe the female has never had an orgasm. Maybe they had an orgasm with a previous partner and he's not doing what he needs to do to tap into her energy in order to make her fulfilled. So in those areas, it's not necessarily about size, because you can have size and not create an orgasm
Right.
for the woman that you're with.
Okay.
It's all about tapping into her emotions. As women, we're
Right.
more emotional than
Right.
men. So if a man is able to, let's say, mind fuck you,
Yeah.
then he's
Yeah.
able to bring that orgasm regardless of his size.
Exactly. Okay. So when a couple or a woman or man or whatever come to you with these kinds of concerns, what type of approaches do you take with them?
Okay. So
Because we know, look, we know we're not using surrogate partners. We know we're not going to go tell them to go play with this person and tell me how it was.
Exactly. Most of the time, when people come to my practice, they are looking for answers because there's some type of sexual dysfunction.
Okay.
Where the woman she tightens up, she has issues with insertion, she can't even get it in there because she's so tight, right?
Yeah.
And then you have issues to where men they're coming too fast or not able to get an erection. And most of the time, if it's not medical,
Yeah.
it's something that's going on with a past trauma that has taken place. And more than likely, when that happens, there is a trauma that has taken place.
Okay.
Whether it is some type of molestation when they were younger,
Yeah.
or it could be some type of trauma as far as a rape that happened as an adult that prevents that person from emotionally being able to connect. And it's like a wall, and they're not able to get an orgasm. So in my role as a therapist, what I do is I deal with the emotional things that block them from having those orgasms or ejaculations.
Okay. And what would you say is the likelihood of success? You know, because it sounds like what you're saying is when you're dealing with your patients, there is typically some underlying issue that you're trying to address first.
Right.
Okay.
So first thing, we address the underlying issues, making sure that conversations are had and tests are done with their primary care physician or their OBGYN to make sure that they are physically healthy.
Yeah.
If they are physically healthy, then we look at the emotional trauma that they may have had, and more than likely there's a trauma there. So what I do is I help my clients by doing psychotherapy in order to take them, and you can't change the trauma, but to be able to not allow that trauma to impact today.
Yeah.
So there's all types of homework that I would assign to them. If I'm working with a couple, little things that they can do to have sexual pleasure, little steps that they would take.
Yeah. Okay.
But I wouldn't see those steps or, part of any of those things that are happening.
Okay. So for you.
I might grab you. Sorry.
That's okay. So for you, size does not matter. Because it's more than that. Yeah. No, well, just what we're talking about. Yeah.
So with me personally, size does matter, but on the most part, size does not matter. It just depends on what you're used to.
On what you're used to.
On what you're used to.
Okay.
And what you're willing to compromise on.
And what you're willing to compromise on. That's good. That's good. So, Dr. Griffin.
Yes.
You have endured with us. Well, I almost feel like we're done with teaming you because it's two ladies, one man, but I'm sure you can hold your own. But
guess what?
What?
If I'm in a room with a patient, it's probably a lady.
Okay.
And the other person is also a lady.
Okay.
So I'm getting double teamed every single day of my life.
Every single day of your life. So
pretty much 5 out of 7 days, probably.
So you can handle it. So walk us through what it takes to become a board certified plastic and reconstructive surgeon.
All right. Where should I start? College?
Yeah.
Okay. So you got to do 4 years of college.
Where
in order to get. I went to Florida A&M University, FAMU.
Okay.
Yeah. I did 5 years there.
Okay.
Try to figure myself out.
That's right.
Met my lovely wife, who just she's working on some TikTok video right now.
Okay.
Maybe she'll join us. I don't know.
Okay. Okay. Love to get her
Um,
perspective.
yeah, she went to Florida State, so we met there. Came back to Michigan for medical school. That was 2002, 2003.
Okay.
Did 4 years of medical school there. So if you don't know, medical school is where you decide what type of doctor you're going to be.
Mm-hmm.
Um, everybody goes through the same school and whatnot, but at that point we go into what is called a match program, and then you decide, what type of doctor you're going to be, and then the residency programs decide whether they're going to take you.
Okay.
So I got accepted into general surgery. I didn't pursue plastic surgery off the bat, even though that was an option.
Okay.
I wanted to be a well-rounded surgeon, physician, learn how to take care of patients. So I did 5 years of that. Then I went into a plastic surgery fellowship.
Mm-hmm.
Aligned myself with a mentor
Yeah.
that really was gonna show me the full gamut of what it took to be a plastic surgeon. Obviously, there's not a lot of Black people in medicine, period, but
Period.
certainly not plastic surgery. You said it yourself. You couldn't
Yes.
believe that.
I couldn't
Yeah.
believe it.
And,
Exactly.
and of
Because
course,
when I'm sorry,
my
when I was,
bros,
yeah, go
that
ahead.
too.
But when I was looking for a plastic surgeon, I would have never thought, one, that I was gonna get one, and then two, I'm not
That's
even
funny
lying.
because
Yeah.
I'm not even pulling my own chain, but in Detroit, everybody knows me. They
Yeah,
do.
that's what I'm finding out now. You know what I'm saying?
That's why I'm surprised they didn't. But
I'm
it's neither here nor there now.
right,
At any
but
rate,
yeah, go ahead.
so so I completed my plastic surgery training. I stuck around the area. I did all my training at Wayne State DMC.
Hmm.
I've been at St. Mary's Livonia for 6 years now as an attending, doing the um, discipline of plastic surgery,
Hmm.
which is not only the cosmetic stuff, breast jobs,
Hmm.
butt jobs, tummy tucks, but also the reconstructive stuff
Okay.
as well. Fixing facial fractures and dealing with wounds and dealing with trauma
Hmm.
and everything else. So,
So tell me
um,
this. What is the plastic in plastic surgery?
so the word plastic really means to change. When we think of plastic, we think of a plastic bottle, but really that plastic bottle has been changed from something else because
Okay.
you can squeeze it, you can change it. You know
Okay.
what I mean? Opposed to something hard that you can't change, something
Okay.
rigid. So plastic means to change, and
Plastic means to
basically what
change.
we're doing, we change bodies. We
Yeah.
take something that's either abnormal and make it normal, or take something that's normal and enhance it.
Now and forgive me because I don't know the lingo and whatever, but is plastic and cosmetic the same thing? Because to me, being a layperson, it seems interchangeable. You have like cosmetic surgery, you have plastic surgery, and I'm thinking it's the same thing.
So so yeah, I mean for the general public, plastic surgery and cosmetic surgery is the same thing. Before, like I just explained, plastic surgery expands well beyond cosmetic surgery. We doing
Okay.
breast reconstruction for
Okay.
cancer. We do a skin cancer reconstruction. We doing facial fractures. We're doing wound care. We're doing cleft lip, cleft palate. We go to Africa and fix.
Yeah.
We go to Guatemala and fix faces there.
Yeah.
So cosmetic surgery is just a small subset of what plastic surgery is, even though the general public aligns itself with thinking that plastic surgery and cosmetic surgery are the same thing. So there's a wide swath, of things that we do as plastic surgeons that I do personally,
Yeah.
not just cosmetic, but dealing with things that fixing people
Okay.
that have
Okay.
things that's wrong with.
And you know what? Before I go to the next question, when I was thinking about this topic, my initial intent was to have, again, a plastic surgeon, a sex therapist, a pastor, and somebody who sold like intimate toys. I think I tried to word it a certain way, but that's what I was talking about. And so
You got 2 out of 4 of us. What happened?
and you know what? And hey, I'm when I kept you guys, I was like, what, bump them, okay. But what ended up happening was, well, the whole point in me trying to have the 4 groups was to really give a broad view of how people can address their needs. I felt like we were going to have the mental side of things with the therapist, the physical side of things with the surgeon, the spiritual side of things with the pastor, and then maybe like some fun things or whatever with the toy person. I wasn't gonna have a show and tell or anything like that, but you guys know, just from me talking to you, what I needed you for. The pastor, and just
I'm gonna say this: the
yeah,
pastor is probably the most anomalous person out of all of this. Like, dang,
see.
we talking about all this, and we bring Jesus into this. I mean,
Listen,
I mean, we might
but
get
no.
struck down.
Well, why? Well, why? Well, why? Because guess what? Although we're talking about it and we're just, talking about it like it could be anybody, with the pastor, I mean, I'm going to respect the profession and say a married couple. But you're not going to have me thinking, this is what I told the pastors that I was coming in contact with who seemed, first I had a bunch who seemed stuffy and uptight. Then I had some who I could tell, they weren't stuffy and uptight, but it just maybe was a little uncomfortable for them. But at the same time, even so far, what have we really talked about that would be offensive? You know what I'm saying? To me, this is real life. People can have some issues, and
Yeah,
how is it being addressed? So, and
Keep it
people
real.
are,
right.
yeah, you know what I'm saying? People are all over the place in terms of where they go to for help. Somebody might not have the resources or the means to go to a plastic surgeon or whatever if it's determined that it's cosmetic and not covered by their insurance. Or somebody may have the means and the resources to do that, but guess what? Maybe they're not interested in that and they want to just talk to somebody, and so they go to the therapist. Or guess what? Somebody, they might not want to do either of that, but they pay their tithes at church. They feel like I should have access to my pastor. I'm going to go get counsel from my pastor. And the conversation that I had with the last pastor that I was going to use, I brought that to their attention because they was looking at the title and they were like, hey, there's no scripture that talks about size. So we started laughing. But I was like, I know that the Bible, if you will, don't really specifically say anything. It's always subject to interpretation. But you're trying to tell me if a married couple, come to you, they're as their pastor seeking counsel, they're saying, hey, look, my sex life is fucked up. Now, they might not be cussing, but they're like, my sex life is fucked up, and you
Oh,
saying,
but you just cussed though.
I did that,
We
and
can
I don't,
cuss.
and I don't go to church like I'm supposed to, but.
Shit.
But okay, let's say they said, our sex life is just not what we want it to be, and the pastor says, well, okay, well, give me an idea so I know how to guide you or whatever. And then they say, well, you know what, I'm not satisfied. I don't know what it is, and me not being satisfied, I'm thinking it's the size. I'm not satisfied, therefore, then he's not satisfied, and it's causing problems in other areas. You gonna send them away? And so that was my approach that I was taking with the pastor. Not that, because my whole thing is, and we can get off this, but my whole thing is the church is come as you are, but it makes people, it makes people feel like they're judging them on where they are.
Yeah.
So anyway, I couldn't get a pastor on because they was like, and again, it goes back to
Well,
some people
I'll
are
tell you
uncomfortable
this:
talking about sex.
plastic surgeons are a whole lot less uptight than the pastors are.
Good.
We got a medical board watching us.
Yeah. I
It
mean,
is what it is.
I get
Latrell,
it. Yeah.
I just want to say culturally, when we look at talking about sex, people have issues within their religion when it
Yeah.
comes to sex. So I
Yeah.
can understand why the pastor may have been, or pastors that you talk to may have been
Yeah.
uncomfortable because they don't like talking about it, even
Yeah.
though it's
People,
something that's normal.
honestly, probably what it is nobody. I'm sorry to cut you off.
That's okay.
Nobody wants a pastor, especially in this day and age, probably doesn't want to align himself with anything like sex related
Yeah.
because they just don't want to. They just
Yeah.
don't want the moniker of, you know what I'm saying,
Right.
Right.
the stigma
Yeah.
of anything sex related because of sex crimes that happen in the church. You know what I'm saying?
Right.
Whether
That
it
could be.
be children in the Catholic Church or
Right.
or you know,
Yeah.
just just infidelity or whatnot
Hmm.
from
But
pastors.
yeah,
So they don't want to. They don't want to align themselves with that. That's
but
fine.
that's where it. I mean, to me, and again, like I already put it out there. I don't go to church like I should. But to me, for a lot of people, they go to church and they're faithful to the church. And so, again, you can't talk about things. I mean, to me, it's appropriate if you're having problems and your go-to person is your pastor. You mean to tell me, it's like, oh, we gonna wish it away. We ain't even gonna talk
Right.
about it. That's just it's just me.
Yeah,
But I,
They
I
would
think
have. They
it's
probably
important.
would have did one of. They would probably do that one on one without everybody else
right,
interjecting.
right,
You know what I'm saying?
yeah,
The flip side is the sex toy thing.
yeah. Oh,
You
so
gonna
let
have
me
to
tell you
show them
something.
toys. I mean, if you selling toys, you
Listen,
gonna have to show them toys.
Listen, what I was gonna do with the sex toy person was just have them, just as well as how we're going through this, just to say, well, what other options are there out there for people if they're not interested in getting spiritual counsel, they're not interested in getting any mental counseling, they're not interested in getting any physical alterations or anything like that. Well, what else can be done? And so I was gonna have them talk about that because those are options too. But anyway, I got the best two people
And
here,
not show the
so.
toys
Yeah, well,
and not
look,
show the merchandise.
I already
You're supposed
scared
to
the
be putting your
pastor.
people on. I mean,
Look, I already scared the pastor off. So, I was like, oh my God, they was
that's
going
what
to
I said. The three of us,
Yeah.
minus the pastor, might have
money.
been something.
Right.
Even though I ain't got much to offer either.
Listen, Dr. Griffin, so tell us name a few of your surgical procedures that might involve surgery on the genitals.
None.
Oh, really? So there are none cosmetically. Like I couldn't
Did
come
I perform? None.
No, not you. Okay, well, let's say in the field. There's nothing.
So it's all vaginal.
Okay, okay.
It's
So,
all It's all either vaginal tightening
okay,
or reduction of what we call the camel toe.
okay.
Making the labia majora smaller.
And you
And
know
I don't
what?
do any of those procedures.
Okay. But Miss Hill,
Uh-huh.
now, do we call this chauvinistic or geared towards men? Because why aren't there any men procedures? Okay, I digress.
Because science.
And
Because
Science. Okay.
science.
It's,
it's because of
But
science.
you can answer that though.
No, I agree with you. It's because of science.
okay.
This area has not been explored as much as it should be. It
Okay.
started off with Johnson and Johnson.
Yeah.
But when you look at within our community specifically too,
Yeah.
it has not been explored as much as it should be.
Okay, okay. So if we got an issue with size, and let's say and the guy is open to something surgically, there's
Uh-huh.
nothing even out there for him. So the woman would be the one going through the surgery if that's what they were leaning towards.
Well, they
It's
have
not.
those pumps. They have those pumps that they can put on
Stop.
to make it.
Stop.
Make it bigger. I don't
You
know, doctor. That's what
stop. Stop right. Stop.
Okay, okay.
So
But
the pumps aren't for size. So let me clear this up. There's
yes, help us,
not
help
one
us.
single there's not one single approved procedure that will make a
Okay.
man's penis larger.
Okay,
Okay.
Not
And
one.
that-
And the
that's-
penis pumps aren't for size. They're not to make a
that's-
man's penis bigger. That's for people that cannot get an erection because they have diabetes, because they have had a prostatectomy and the nerves have been
Damaged.
dissected to where they can't
Okay.
get an erection.
Okay.
That's what penis pumps are.
And
So we got to clear that up because everybody likes to throw in penis pumps like it's a cosmetic procedure, and it's not. And I'm not
okay.
even a urologist,
Okay.
but
But
um,
that is not a professional surgical procedure.
I am
it's
so
not.
happy that you are clearing up this myth right now.
There's a lot
Right.
of
There
myths.
are
There's a
men
lot of myths.
investing in these items because they think that it
Yeah,
can increase the size.
exactly. It's going to heal them in some type of way. Actually, it might do more damage.
It basically there's one procedure, and that's called you divide the suspensory ligaments, but that just drops down your penis to make it look like it's bigger, but it's still if you got a 5-inch penis, then that's what you got. It
Okay.
just creates an illusion. It brings everything kind of forward,
Okay.
and so if a woman says go deeper, he's still not going to be able to go deeper.
Okay. Okay. So, in your opinion, I think you already said this. Well, for yourself, I know that you have way more female patients. Now, but in the field, and I probably could answer this, is it more, in your opinion, more women or more men that use cosmetic surgery?
90, probably 95% women.
Probably 95% women, which, I kind of figured that it was more women. I didn't know it was probably, all women because that's
What did you think?
who me.
Yeah.
Maybe about like 60, 40.
60? What?
Yeah, because
60?
think about it, like actors, you can't tell me that they ain't out here having
Oh,
cosmetic
okay.
surgery, so
Yeah, but so what percentage of people are actors in the general population?
I think it's more men.
No, no. What percentage overall are people
Oh,
are people actors? You're saying
oh,
that the actors get the procedures done,
yeah.
which
Okay,
you're
so
right
that's a
about.
small percentage.
So, like,
Yeah,
I don't know
okay.
how many people in the general population are actors
Yeah,
by profession.
okay.
It's a very small percentage.
Okay.
So for the men, there's two procedures that probably I do that make up that 5%, and that's gynecomastia surgery,
What's that?
and that's if you got man boobs.
Okay, okay,
Uh,
That's that's a non-technical term,
okay,
and that's basically a procedure to reduce the kind of feminizing breast tissue that you may have.
okay.
And men get liposuction and tummy tucks and stuff like that, especially if they lose weight. I've done 360 lipo on men, and
Okay.
abdominal etching. That's another one. Make it look like you got abs.
Mhm.
But most men don't get it, and that's the reason why is because
It's
if they're
not.
doing it, first of all, plastic surgery is done because that person wants it.
Yeah.
It's not because of society saying, well, for women, it's more society saying you got to look like this.
Yeah.
But for men really,
Men are
most of your
probably
friends,
more.
listen, most of your friends like men with dad bods. Y'all accept dad bods, especially if he got a fat bank account
Well,
and got swag and got all the
yeah.
other stuff. But
But you know what?
nobody cares about a man's big. Y'all love the belly on a man.
Look, what
I'm
and
sitting there
what's
doing
oh, they
27,000
fall in
sit
love
ups
with
a
the
day
they
for
fall
me.
in love with the belly because they're in love with the man.
right. And you know what? Give women some credit. We let men slide with a number of things on their looks because that's not important to us.
It's
Where
not.
it
It's
is,
not number one.
exactly, it's not number one. Versus or in reverse when it in comparison to overall men,
Yeah,
so
men are visual creatures. There's
that's
no
right.
doubt about that.
That's right. I agree with that.
Very visual. That's probably why more women are getting surgery
Yeah,
because they feel as though their self-esteem that they're not measuring up to
that's
what
right.
society says
Okay,
that
so let me talk about that. And you're right about that. So there's men will, but men so men are more secure with their natural bodies.
Yeah,
Women are too in
yeah,
general. Actually, women are too. And if they do something, they do it for themselves. They don't do it to attract a men.
right.
Uh, attract men most of the time. They really don't.
You're right.
Uh,
It's going to attract men, but they're
it's
probably not
going to,
doing
but
it.
that's a
Yeah,
secondary thing.
you're right.
A man is going to love you or he's not going to love you, and it has
Right,
nothing to do. Because I will tell you this: plastic surgery can enhance a relationship.
right.
Getting your butt done, getting your tummy done, it can enhance it, but it won't save your relationship.
That's right. I agree with
Studies
that.
have shown that
I
it won't
agree.
save your relationship, and it won't get you a man if you don't have one.
Yeah, I agree.
You know,
Yeah.
the
But
man
what?
that you want, I don't
And
know.
it gets you the wrong type of
It'll
man.
get you, may get you the wrong kind. Yeah.
Yeah,
Right. It may get you the wrong kind, huh?
yeah.
What about and this I guess it can be the last thing because I know you guys are extremely busy and I can't thank you enough for being here. But what do you think about this? It seems like when we think about sex and size and whatever people's needs, preferences are, or whatever. But do you really think sex was the concept of it was really designed for women? You know, and I say that because we have cultures and religions that do female genital mutilation, and I read that they do that because they want to control the female sexual desires and increase fertility. I'm not sure that that works, but you know what I'm saying? So
It
what's the
doesn't.
point? Yeah, and what's the point of
It
doing
doesn't.
that? What's the point of doing that? It, you know, if not for to keep a woman from enjoying sex. You see what I'm saying?
I believe sex was designed to produce and also for enjoyment.
Uh
It's the
huh.
way man views sex that distorted it. Because if that's the point, you can just have sex and produce and not have any enjoyment out of it. But the
Right.
fact that naturally you enjoy it is part of it.
Right. But
And
I'm
it's
saying
more.
with the cultures and religions that mutilate a female's genitals to
Hmm.
make sure that they don't enjoy sex. So again, it's like then you have this this woman who doesn't enjoy sex because her stuff is messed up, right? And
Right.
but the man does, you know. So it's like, you know, so the woman is there just to produce children. So again, I'm
Right. But
thinking,
that's from a
I'm
cultural
glad I'm not part of
perspective.
that religion. I
Right.
know I know what religion that is, and I ain't gonna speak on it. And I've seen it, and I'm just gonna leave
right,
it at that. But
right,
there have been advocates against the, female genital religion,
yeah,
female genital mutilation,
yeah,
and perpetuated by religion.
yeah,
Right.
And it's in Africa. It's amongst our people in the Islamic, countries there.
yeah,
Um, and there have been, that was part of our medical school curriculum when we talked
see,
about, um, what can we do to combat this, because
yeah.
that's
Right.
It's
that,
deep.
that it, it's deep. Yeah.
It's deep, you know. So, but I didn't mean to cut you off, Miss Hill. But what were you saying about that? Because I do agree with you. I think naturally, men and women we enjoy sex, but you know, history and what's still going on in other places or whatever in terms of making sure that you know a woman doesn't enjoy it. It's like, well why would you do that? I mean, what?
It's part of control.
Yeah,
Part of control. And sometimes people are controlled through religion.
yeah.
And I'll leave it at that.
It's more than sometimes.
Makes sense to me, but
I'm glad we. Oh,
what?
the pastor might have had something to say with that if he would have came on, but
If he would have came
Yeah.
on,
if he
he
would
could
have came
have
on, he
exactly. He
could
could
have.
have helped cleared it up. He could
But
have, you
I'm
know,
like you. I'm gonna leave it at that.
leave it at that.
I'm gonna leave it at that.
But thank you so much for joining me today. I mean, again, I can't thank you enough. When I was coming up with this topic, like I said, I never thought that I would get the professionals that I have, and I'm just, you know, forever grateful. And it's just putting it out there. And look, here you are, you know, the
Yes.
main two, you know. And I'm going to make sure that I have your information attached to this video so whomever see it, that if they want to contact you for some personalized attention in your fields, that they can do that. So again, thank you very much, Miss Hill, for joining us.
Thank
Thank you very much,
thank
Dr.
you.
Griffin, for
You were very
joining us.
informative. Yeah,
And
Conversation
we
that needs to be had. So
it
thank you
does.
for
Absolutely, absolutely.
absolutely, absolutely. And I'm going to make sure that we come back together on another topic because this certainly was fun. So y'all
yeah.
hold on one second.
Hands up.